Alcohol detox general symptoms. Next to substance addiction, alcohol addiction is undoubtedly one of the most incapacitating forms of dependency. There are actually a lot of Americans, from both male and female, who are certified alcoholics and have used alcohol as a crutch to help them deal and cope with the harsh realities of life. Whether it is a cowardly form of escape, a crave for a few minutes of sheer oblivion, or a false source for mustering courage, there is certainly an alarming increase of people who are addicted to the addictive numbness of intoxication. Alcohol detoxification is an effective process of purging alcohol from the body of an alcoholic for a given period of time. This can be a very difficult and painful period for alcoholics, since they are literally forced to give up abruptly an addiction that they had for a long time. Predictably, the patient will experience alcohol detox symptoms that can develop some quite fatal complications and very upsetting for family members to witness. This is the reason why it is highly advisable that alcohol rehabilitation will only be done in a medical facility under the supervision of competent medical professionals. Some of the most common alcohol detox symptoms are uncontrollable chills, vomiting, and loss of appetite headaches. In worse cases, alcohol detox symptoms can also be more difficult since patients will experience severe anxiety, auditory hallucinations, rapid pulse, and inability to sleep or insomnia. There are some recorded highly severe cases that have displayed alcohol detox symptoms that include delirium tremors, grand mal seizures, and autonomic hyperactivity. However, the severity of the withdrawal symptoms experienced by patients will vary from one case to another, largely dependent on the patient's history of alcohol dependence. To better deal with the alcohol detox symptoms, the patients are provided with medications, which includes anticonvulsant and benzodiazepines that could considerably alleviate some of the physical symptoms. It can prove to be quite a nightmare for the patient and extremely stressful for close family members. Patients who are undergoing withdrawal symptoms are known to display some tantrums, hysterics, and would even resort to emotional blackmail as a form of resistance to the treatment. The family should be ready to understand and provide a strong support system to help the alcoholic person go through the process successfully and with lesser complications. Aside from alcohol detoxification, the patients will also need to undergo a counseling program that will help them withdraw from alcohol mentally and emotionally.
For more content like this, please visit learnforfree.biz.
Content produced and distributed by AllSuperInfo. All rights reserved.
Discover the proven formula for automated sales and success that you can apply to your business in under 30 minutes.
Reserve your seat at allsuper.info/webinar.